Happy Wednesday, Facebook friends. We are so happy that you've decided to join us tonight for another edition of our Heart to Heart Facebook Live panel. This is the fourth panel, I believe, that we've done since we started this, and we are looking forward to being able to bring many more to our Facebook friends. So it's such a great forum to talk and to bring information that's relevant and important to our audience. So thanks for joining us tonight. I have been so excited about tonight because I have two fabulous physicians with me tonight to talk, and we're going to just pepper them with as many questions as we possibly can. I might even try to put them on the spot a little bit and make them squirm just a tiny bit. It's good for them. It's good for them. So anyhow, we are so excited. And if you have questions, please drop it in the chat for us. We'll do our best to answer those questions. And everyone who puts a question in the chat, your name is entered into a drawing for some Heart Hospital swag. Who doesn't want a shirt or something like that? So drop your name in there. So we're going to get started. You know, one of my favorite things to do at the Heart Hospital, I have two favorite things. One is to show off the house. I love to give a tour of the hospital and show people what we're all about. Second thing is to show off our physicians, because we have such great talent here available in Central Arkansas, actually available to the state, so I always like to get them out there. So we're going to do that. I have two physicians with me tonight. I have Dr. Paulo Ribeiro and Dr. Mahesh Bavineni. Thank you for being here with me tonight. We're just going to get comfortable and have a little visit. Before we go into, I've got your bios and I'm going to fill in all the blanks, but before I do that, I want each of you just to tell our audience just a little quick something about yourself. So let's start with you, sir.
Thank you, Vicki, for those kind words. It's a privilege to be here and share with Facebook a few questions. And I'm a heart doctor, and I've been taking care of patients. It'll be this year 46 years.
Oh my goodness.
So I've seen a few patients here and there, and every day we have a great story. Every day magic happens.
It does indeed. Dr. Bavineni, what would you like to say?
Vicky, thank you for having me here with Dr. Ribeiro. And then I've been in Heart Hospital for the past close to a year, and I'm happy starting seeing patients and then taking care of fellow Arkansas people here.
Good. Well, we couldn't be happier to have you on our panel tonight. I'm going to read just a little bit from Dr. Ribeiro's bio so you all will know who he is and what he does. He's board certified in cardiology. He received his medical degree from the Universidade do Porto in Portugal, and his PhD from the Universidade Nova de Lisboa, and I hope I said those names pretty close to what they are. He is a fellow in the American College of Cardiology and the European Society of Cardiology. He is published. He's written 130 manuscripts, 34 papers in peer-reviewed cardiology journals. So he is well-traveled. He's passionate about his patients. He's passionate about his practice. And we welcome you, Dr. Ribeiro. Thank you so much for taking time to join us.
Thanks.
And not to leave you out, young man, Dr. Bavineni. Dr. Bavineni is a general cardiologist who has been practicing here with us since 2016. Been at the Heart Hospital we're right at a year, aren't we?
Close enough.
Good, good. Happy anniversary. We are glad you are here. He graduated with honors from the PSI Medical College. He completed his internship in internal medicine at Louisiana State University Health Sciences Center in Lafayette before heading up to Toledo, Ohio to Mercy St. Vincent Medical Center, where you served as chief resident and completed your internal medicine residency. He completed his cardiology fellowship right here in Little Rock at UAMS. And then Dr. Bavineni has a strong passion and interest in prevention and healthcare management. He actually went on and earned his MBA here at Euler. So you've kind of just really settled in, I believe. He's board certified in internal medicine, cardiovascular disease, echocardiography, and nuclear cardiology. Dr. Bavineni, thank you so much.
Thank you, Vicky.
We're glad you're here.
Pleasure is mine.
As I promised, two very fine physicians that are able to answer your questions. Once again, I encourage you to participate, drop a question in the chat, but I'm going to get us started. And I'm going to start with you, Dr. Ribeiro. So this is Heart Month, and the purpose of tonight is to talk a lot about our risk factors that are associated with heart disease. We want to take time to address some really important factors related to the #1 killer of men and women in Arkansas and the United States today. So my first question to you, sir, is what do you think is the most important risk factor to be aware of when we're talking about heart disease?
Nutrition. The heart disease, coronary disease, is a disease that is preventable. And it's still deeply ingrained in the medical community, even physicians and patients, that we have coronary disease and heart disease because we inherited from the genes of our parents. And that's really not the case. The science clearly shows that this disease is preventable, and the reason why children have the same disease as their parents because they eat the same bad things.
That is true. Now, one of the things you need to know about Dr. Ribeiro is he's extremely passionate about the nutrition of his patients. This is very important. He looks at it as one of the foundations of how we can keep our patients healthy, is looking at that piece of the puzzle. So, Dr. Bavineni, many young people are under the impression that they don't need to worry about developing heart disease. Only older people need to worry about heart disease. Is that true or false?
It depends on the situation, but mostly we have been seeing a lot of young people also having cardiac arrest out of the hospital, coronary artery disease. Mostly coronary artery disease is seen in people, starting from 40 years. But, Dr. Ribeiro can attest the fact that he have seen young person coming in with a STEMI to the hospital. The youngest I have seen is 32-year-old.
Okay.
Came with an acute heart attack. We did a cath, and then we found 90% blockage in his right coronary artery. So it can affect anybody, but mostly seen from the age of 40 years.
Right. So just because you're young doesn't mean that you can just write this off and think, I'm never going to have an issue.
Exactly. That's the point, Vicky.
We've all. So Dr. Ribeiro, let's talk about smoking for a minute and vaping. We know that smoking is the #1 reversible risk factor. So we know, number one, it's a risk factor. We know it's a reversible risk factor. Talk to us about, if someone has smoked for years, is there still a reason to stop? Can we reverse any damage that's been done to the heart as a result?
Yeah, if you stop smoking, you'll have a benefit within 24 hours.
Oh, wow.
And at some stage, the risk, for instance, of lung cancer, perhaps about 10 years, can become pretty low and perhaps even similar to a non-smoker. So the benefit of stopping that wretched habit will be immediate, and every human being who stops smoking will benefit from that. But it's so difficult to stop for so many humans. So addictive.
Vaping is very trendy right now. Do we know enough about vaping? I know we just say no, don't do it. Just don't do it. What is your thoughts on, they think that there's a bridge to help me to quit smoke, but I don't know that that's truly the case. What are your thoughts on vaping?
Well, we do know that vaping can cause extreme damage to the lungs in young people, and we had one of our colleagues that had a son who had a serious problem with vaping in the lungs, and we looked at that 2 years ago, and the FDA had up to 600 cases where the lungs were completely damaged from vaping, and many of those were going to not survive or be a candidate for a lung transplant. So vaping is very dangerous for the lungs.
Do we have any data at this point in time on how it impacts the heart, or are we just all speculating on the heart, on any kind of heart damage?
I don't think we have epidemiological studies and large scientific studies to see if it impacts on coronary artery disease and how it impacts, but we know that it impacts in the lungs.
And that should be enough to say no, yes. We think. Dr. Bavineni, more than 37 million people in the United States suffer from diabetes. And we know that this is also a risk factor. It's a big risk factor for heart disease. I read a statistic that 2/3 of our diabetic friends actually will die of heart disease based upon the damage that the diabetes does to their system. So tell us how that affects our heart health, and what's the most important thing diabetics can do to protect their heart?
Just to add to your statistic, Vicky, also CDC came out with this article recently that 1 in 4 diabetic population people will suffer from some kind of coronary artery disease.
Oh, wow.
And then of people aged more than 65, 70% of them are going to be affected with coronary artery disease, especially in males population. So it's a spectrum. Diabetes by itself, you're going to have other comorbidities like high blood pressure, high cholesterol, and there is this epidemic going around called the metabolic syndrome. So in diabetes, in conjunction with this metabolic syndrome, basically what it means, high blood pressure, high cholesterol, high triglycerides, and also high waist circumference by itself can increase the free radical injury to our body, and it's going to fasten the plaque formation in our blood vessels, and that's when people get affected by coronary artery disease.
So that the diabetes does have that impact then on those coronary vessels just from the damage it's doing to the system. Those statistics are pretty shocking, not shocking,
Right.
but they should be jarring to
Right,
us
right.
to allow us to really
Right.
think. So for our diabetic friends, compliance is super important.
And then very strict glycemic control, and then periodic follow-up with your doctor.
So whether diabetic or not diabetic, Dr. Bavineni, are there foods you would say we would avoid to keep our hearts healthy?
If there's one main food which you want me to concentrate on in diabetics and others is the carbohydrates. So that's why, there are like a lot of diets around, floating around, in social media, everywhere. They say keto diet, they say Mediterranean diet, this diet, dash diet, so.
Yeah. Dr. Ribeiro, what would you add to that? Because I know nutrition is super, super important to you and your patients.
Well, I think the key concept that leads to obesity that then leads to diabetes is, as Dr. Bavineni very well said, the carbs. And there are two types of carbs. They're the good ones and the bad ones, if we could separate them. And there's a concept that is key to nutrition, which is a glycemic index. That means that there's certain carbs, like, for instance, sweet potato, that has a glycemic index of 53, where the sugar is leaving the stomach to the blood slowly, and you burn those calories, and your insulin is low in the blood, and you're not hungry. And then you have the bad carbs, the high glycemic index, like, for instance, a saltine or a potato, where the glycemic index is about 93. And that means that as soon as you have a saltine, the sugar, the glucose in the blood may go to about 300 in 15 minutes. Your insulin jumps up and changes that glucose, that sugar, into fat. And every time the insulin jumps up like that, it damages the arteries of your neck, and then you can have strokes, damage the arteries of your heart, and then you have coronary disease that we're talking, the blocked arteries in the heart, or can also damage any of the arteries of the leg. So that's a key concept, and it's a concept that doctors need to talk to patients about, and patients need to know that the glycemic index is key to be healthy and to avoid obesity, diabetes, heart disease, and cancer.
That's great. We in the past we've held some diabetes boot camps here, and when we would educate and we would share that information, I had so many patients say, no one's ever told me that
Right.
before. So I think one of our places we're kind of missing the boat is really educating those patients on why this stuff is so important and how their body responds or doesn't respond, and getting that information out there to them. So in a few minutes we're going to take a break, but before we do, Dr. Ribeiro, recently we've had Damar Hamlin in the news with his cardiac arrest. And so it's been like talk of the town. What is cardiac arrest? What is a heart attack? So would you tell our audience, they're not the same thing, are they? But people mistake them. What's the difference between a cardiac arrest and a heart attack?
As a matter of fact, the majority of cardiac arrests are due to a heart attack, to a phenomenon that was described by Mike Davis 30 years ago. I had the privilege of working with Mike Davis. He was the St. George's professor of pathology. and he described these plaques, which are the blockages inside the arches of the heart that can be very small, but if they have a bit of an opening there, what we call a tear or fissure, and as soon as the blood gets in touch with that inside of the plaque, you have a clot, and the artery closes. And some patients, when the artery closes temporarily, have a heart attack, but some of them don't even feel it, others drop dead. And that's what we call a cardiac arrest, is when you die. And the great majority of those cases are due to this phenomenon called plaque rupture.
Okay. What would you add, Dr. Bavineni?
And then, as we are talking about competitive sports here, so blunt injury to the chest wall can cause something called commotio cordis, which can temporarily, cause cardiac arrest. As Dr. Ribeiro, explained really well about plaque rupture and stuff, commotio cordis is towards the other spectrum, where just the sheer force of blunt injury can cause someone to have cardiac arrest.
Which is what we think happened in Damar Hamlin's case. And we've also seen it in other sports, baseball, where they'll take a hit with a baseball.
Hit with the baseball,
chest,
yeah. Every other sport, boxing.
Right.
It's just the sheer force of the blunt injury,
Right.
which the athletes, are getting exposed to.
So cardiac arrest is one of those things that if they can get CPR, we can save a lot of lives.
Exactly.
They tell us in that for every minute that you don't get CPR and you're down with cardiac arrest, your chances for survival decrease by 10%. So it's really critical that if you know CPR, you go ahead and engage and help these people out.
And also to add to this point, Vicky, that's why having an AED available, in schools, libraries, restaurants, like our day-to-day situations,
Yes.
has become very crucial.
Yes.
Because getting that initial defibrillation shock can save a lot of lives. And majority of the cardiac arrests happen out of the hospital.
Right. I think I'm into statistics this week. I think 70% of those of our cardiac arrests happen in the home, and definitely outside of a hospital setting. So more in the home setting. So it's really important that we kind of know how we can help those in our household with CPR. So we're going to take a quick break, and then we'll be back to hear more from Dr. Ribeiro and Dr. Bavineni. Again, if you've got some questions, go ahead and shoot them on through to us so that we can get these guys to answer these questions for you. So we'll be right back.
Your heart is special, and it means everything. Your heart moves you, motivates you. Sometimes it skips a beat. Sometimes it stands still. Your heart is important. It's powerful. And something this special deserves specialized care.
The choice is yours. Choose the only hospital in the region dedicated entirely to your heart, Arkansas Heart Hospital. Why would our second hospital focus on bariatric surgery?
Encore Medical Center is home to our Bariatric and Metabolic Institute,
where we take a whole new approach.
Losing weight for heart health.
Here, we help patients reach their weight loss goals, reverse diabetes, and improve their quality of life.
Encore is our second act. Let's get started on yours.
Your heart is special, and it deserves specialized care.
The choice is yours. Choose the only hospital in the region dedicated entirely to your heart, Arkansas Heart Hospital.
Welcome back. I am Vicki Wingfield with Arkansas Heart Hospital, and sitting in with me tonight, Dr. Mahesh Bavineni and Dr. Paulo Ribeiro, and we are talking about risk factors of heart disease. So, Dr. Bavineni, you're up. I want to talk about women and heart disease. Are you game?
Always.
Always. It is the #1 killer of women. It kills more women than all of the cancers combined, respiratory illnesses, and car accidents. That's a lot of lives. So the Go Red for Women movement was launched by the American Heart Association in 2004. And its sole purpose was to really get women to be aware that this was an issue for them. At that time, the statistic was 1 in 3 women would die of heart disease. The statistic today is 1 in 5. Now, that's good. We've made some progress, but I'm just a little miffed that we've only come down 2 lives in 19 years. So what is it that we need to be making sure our women know about heart disease? Are there different warning signs for women? Do hormones play a part in heart disease? So what do we want to tell women about heart disease?
Vicky, as you rightly touch based, women are made special.
They are made special.
And we got to treat them special. So women, as with everything in life, they have high tolerance.
Okay.
So they tend to neglect their symptoms. They do not listen to their body. So, and then also, as you rightly said, hormones. It's this article everywhere floating in the social media. If you Google, like, estrogen protects women from having coronary artery disease. Mm-hmm. There is some truth to that. But once, women reaches menopause, with the hormonal changes, the scales tend to shift, and they are at very, very high risk, from having coronary artery disease or congestive heart failure, all the cardiovascular diseases. So women have very atypical symptoms. Okay. They might not have the classical chest pain, which is described as, hey, clenching my fist, pain worse with exertion, relieved with rest. So they tend to have mostly fatigue, shortness of breath. And then when, they're experiencing these symptoms, they got to be screened. The only way to prevent, premature coronary artery disease or catching coronary artery disease at the late stage is to start early screening, and prevention is the key here.
So prevention's really a big deal, whether it's women or men. We really need to be on that prevention bandwagon. Dr. Ribeiro mentioned earlier that it's not necessarily always genetic and that we know it can be prevented. I think the number is 80% of our cardiovascular disease could be prevented. And it makes me ask the question, if that's the case, why is it still the #1 killer? If we can have 80%, the opportunity by 80% to prevent it, why is it still the #1 killer? Your response about women, that makes sense. There is a high tolerance, and we do tend to put ourselves last. There is the hormone issue that we need to be aware of. What would you say was your best advice for a woman to keep her heart healthy?
Get screened early.
Get screened early. Get screened early. And there are ways you can do that. The Heart Hospital actually has a beautiful screening called the Keep the Beat screening, where you can come in and it's 9 different tests that you can just look. It tells you where you sit on that cardiovascular continuum. It's an EKG, it's a CT scan of the coronaries, it's a full lipid profile, all important information that we do here on site 5 days a week. So that would be important. So prevention is good. What would you recommend, Dr. Ribeiro?
Well, I think the key is to eat healthy, but the big problem we have is that we need to have the nurses and the doctor, when they have their training, they need to have training in nutrition. So the big problem we have, I think, in this country to prevent these heart attacks is to have the medical community trained so that then the patients can learn what is a healthy food. And of course, that's absolutely the key to prevent and to bring these numbers down. But until that happens, it's going to be very difficult because the majority of the population doesn't know that certain foods are extremely toxic. Like, for instance, take ketchup. Take high fructose corn syrup that's in ketchup. If you dry a jar of ketchup, a third of it is high fructose corn syrup, which is sugar that derives from corn. and it causes havoc and inflammation in the liver. It causes havoc and inflammation in the heart, causes havoc and inflammation in the whole body, and creates hypertension. So there are so many foods that are so toxic and create all these diabetes and these hypertension, but the population is not aware of this. So until there's a new training and this information of what is a healthy nutrition is spread to the population, it's not going to be possible to prevent coronary disease.
And I think prevention is also something that we have to continually educate on owning your own health. I have to make some decisions, and those are decisions in the cardiovascular arena we're not always willing to make because they mean I have to give up something. I have a viewer question that says, why do I have high blood pressure if I'm not overweight and I eat healthy? Who wants to take that one?
Sure, I'll take this one.
Okay.
So there are a lot of other several factors for someone having high blood pressure. It's not always related to the weight. You might have been born with a congenital condition which can drive up your blood pressure. You can have hormonal imbalances which can also drive up your blood pressure. So it's just a spectrum of various diseases. Being overweight doesn't really translate into having high blood pressure or diabetes. And also the fact, as Dr. Ribeiro has been telling us, nutrition plays a very, very important role in the blood pressure spectrum too.
Yes, and I would add that that's a very good question, that the great majority of hypertension is again totally preventable. The main cause is the population eats too much salt, sodium, and in United States we have between 4 and 7 grams of sodium a day, salt, and we should have around 1.5 grams. And even if you don't use a salt shaker, with a processed food that you have, we are all eating too much salt, which is the main reason why hypertension is so prevalent. And the second one is you may have the right weight, but if you don't exercise, you're going to have very possible hypertension. But if you have the right weight, if you exercise, if you eat a diet that is very low on salt, the probability of you having hypertension is very low because, as Dr. Bavineni pointed out, there are just very few medical conditions that will cause hypertension, and it's virtually always preventable.
So we really need to be looking at sodium, and we need to be looking at some exercise and making sure our movement's out there and we're doing well. So this is something I just heard about this past week, and you may be aware of it, and so might you. I had never heard of it. There was an ad on the radio, and it was saying, are you a deer, are you a bear, or are you a tiger? And it went on to say that we can genetically test you and identify if you're a deer, a bear, or a tiger, and then we can tell you what diet you should be eating. So like they said that the tiger would do best on a keto diet, and the bear would be best on a balanced diet, and the deer would be best as a vegan. Have you heard about this? Is the APOE gene that they're testing for?
I can't comment on that specific question, but what I can tell you is that the issue of the diet to me is a critical one because, as Dr. Bavineni mentioned, we have all these arguments, even in medical symposium, which is the best diet. But if you look at the evidence on all diets and nutrition, is that after the patient stops the diet, within 2 months, 95% that the weight is regained. So I always wonder, why do people diets? And what really the population needs to do, rather than have a diet and be miserable for 2 months, and then after those 2 months regain the weight, I think that what we need is to eat healthy. The population needs to eat healthy throughout their life, and that's the key. And there's a lot of studies. You could read, for instance, the Blue Zone book, which is a great book for everybody.
Right.
For instance, in California, we have a city of Loma Linda where I worked for 10 years, and the population in Loma Linda, they are mainly vegetarians. It's a religious issue, and the studies that are scientifically very sound studies, and they're done by Gary Fraser, have shown that, for instance, if you eat healthy and become a vegetarian at the age of 30, if you're a female, a woman, you're going to live 6.5 years more than any other woman in the United States. If you're a male, like Dr. Bavineni, and let's say that at the age of 30 he decided, I'm going to be a vegetarian, of course they don't smoke, he would live 10 years longer than the other males in the United States. So this is overwhelming scientific evidence that if you eat healthy throughout your life, you're going to have less cancer, or probably 50% less cancer, and you're going to live much longer. But you need to eat healthy throughout your life, because this thing of having a diet for 3 months, I think is a total waste of time.
It's a discipline. Have you heard of this genetic testing for eating like you're wired, how you're wired, so to speak?
I have seen a couple of social media posts out there regarding this, Vicky, but there's no scientific evidence for that yet, because they have not established a cause and an effect relationship, like we speak in medical world. So, are they measuring metabolic rate? I don't know. About how fast you process foods. Right. There's no scientific evidence to support that as of now.
Okay. It was just so curious to me. It was like, I don't know if I'm a deer, or what do I want to be?
Right.
Do I want to be a deer or a bear or a
Right.
tiger? I don't know. I just want to eat, pretty much. So I'll try to eat better, Dr. Ribeiro. I will do better. So let's drop into this, and I've got another viewer question, Dr. Ribeiro. When I ask it, you're going to understand why I'm asking you. Is red wine bad for the heart?
Now, that's a great question.
That's a great question.
I love wine, but the wine became very popular as a healthy drink because of the French paradox, where many years ago in France, the French eat a lot of fat, saturated fat, which is so-called the bad fat in those days, and they had much less heart attacks than the rest of the population in Europe. And it came out, they drank a lot of wine. So that's how wine became known as a healthy drink for the heart. And of course then they isolated that substance called resveratrol that is an antioxidant, but we already know now that you would have to drink hundreds of bottles of wine to have enough resveratrol to have any significance. But so I think that nowadays what we do know, and this is very important information, is that alcohol in any dose is bad for our health. Because it has a metabolite called acetaldehyde that causes cancer. And, I think with alcohol we are where we were the smoking around 50 years ago, that one of the main causes for cancer is alcohol. GI cancer, stomach cancer, mouth cancer, liver cancer. And women shouldn't drink more than one drink of alcohol in 24 hours, and men too, but that's because of the old recommendations. But I think nowadays we know that ideally for our health, we shouldn't drink alcohol. So there's really no scientific evidence that alcohol is good for the heart. And I would say that a glass of alcohol, of wine, for instance, or one shot of whiskey has about 90 to 100 calories. That may translate in 1 year of 15 pounds of weight if you have a drink every day. And if you want to lose weight, just remember alcohol has a lot of calories.
Okay. So you mentioned when we talked about women and heart disease, you had a little blip in there. We talked a little bit, just a tiny bit about menopause. So I have another viewer question. And the question is, does menopause increase blood pressure when hormones are out of balance?
It tends to do that because everything in the body are interlinked to each other with the hormones, and then with the blood pressure, there is something called renin, angiotensin-aldosterone system, which might get overactive. So there are certain medicines to keep it under check. So that's why it's always good to follow up with your primary care doctor or with your cardiologist, to keep ahead of the curve, to make sure your blood pressure is not running too high during the menopausal stage.
We know that menopause can be tricky, and we also know that it just impacts everybody differently, and there's so many things to keep in mind when we're looking at someone who is going through menopause and these different things happening to the body. Primary care physician keeping plugged in, your gynecologist keeping plugged in, your cardiologist keeping plugged in. I think it probably takes a little bit of everybody looking at every angle to say really what is driving this. So, hey, here's another viewer question. Tell us what you think about Himalayan pink salt. Is it any better for you than regular salt?
Oh, that's a very interesting question. One of the very popular salts that is used is sea salt, and it's a panacea here. And I have many patients who tell me, that's okay. I don't have salt, I just have sea salt. Well, as a matter of fact, sea salt, we produce this in our country. As you know, you dry the water of the ocean and you take the salt, which is one molecule of sodium, one molecule of chloride. Well, the regular salt that we extract, for instance, in the United States, because North America was under millions of years was under the ocean, and the ocean dried and disappeared, and then it left the salt mines. So it's the same thing. It's sodium chloride. So there's really no difference between sea salt and sodium, which both are salt, and regular salt. They both cause hypertension. They're both exactly the same, but the population is convinced that sea salt is something magic. Regarding the Himalayan salt, that's a different story, because the ocean is contaminated these days with PCBs and mercury. So when you dry salt water from the ocean, you're going to have a lot of contaminants. Well, the Himalayan salt when the Himalayan salt was formed, that was millions of years ago. That was before the pollution of the ocean, well before. So it is very pure. So I would say, great, have Himalayan salt, because you won't have the pollutants, which is mercury and PCBs that regular salt would have. So I think that's a big advantage. But it's still sodium chloride, and it still will raise your blood pressure if you have too much salt.
So don't necessarily go clear the shelves of Himalayan pink salt just yet. It still has an impact.
And just to add to that too, Vicky, life is all about moderation. I mean, It doesn't necessarily, if you are using pink Himalayan salt, to put one extra spoon in your cooking. Doesn't matter. Sodium is sodium.
I agree. So we're going to take another break, but very quickly, in 2 minutes or less, I have another blood pressure question. Is my risk greater for high blood pressure if I have a family history of hypertension, Dr. Bavineni?
As we touched base earlier, majority of the cases of high blood pressure are related to nutrition. They're only like 10% of the cases which we had in our earlier discussion, what medical conditions can put you at increased risk of blood pressure. If you have one of those medical conditions as you inherited from your family, then yes. If not, not really.
Okay. So once again, our genetics does have some play, and some have some input into our overall health for several different things, but we do know that hypertension is one of those where genetics could end up being something we need to really pay attention to. When I'm out in the community and doing a blood pressure screening, and I have someone that sits with a high pressure, one of the first things I say is, tell me about your family history.
Right.
And then we talk about what's going on at that point in time, but I always say, because of your family history, we're really going to want to monitor this, because you may not have it now, but as you mature and get older, it may very easily pop up just because of that genetic background. Okay, good deal. All right, we're going to take another quick break, and when we get back, are you guys ready for this? I'm going to do rapid fire fact or fiction. Are you ready for it?
Bring it on.
All right, okay, good deal. We'll be back in just a minute. Y'all go grab a healthy snack and come back.
Your heart is special, and it means everything. Your heart moves you, motivates you. Sometimes it skips a beat. Sometimes it stands still. Your heart is important. It's powerful. And something this special deserves specialized care.
The choice is yours. Choose the only hospital in the region dedicated entirely to your heart, Arkansas Heart Hospital. Why would our second hospital focus on bariatric surgery?
Encore Medical Center is home to our Bariatric and Metabolic Institute,
where we take a whole new approach.
Losing weight for heart health.
Here, we help patients reach their weight loss goals, reverse diabetes, and improve their quality of life.
Encore is our second act. Let's get started on yours.
Your heart is special, and it deserves specialized care.
The choice is yours. Choose the only hospital in the region dedicated entirely to your heart, Arkansas Heart Hospital.
Thanks again for being part of our Heart to Heart Facebook Live panel tonight. Huge thank you to Dr. Ribeiro and Dr. Bavineni for taking time out of their day. You know, they've both worked all day and they cruised over here to sit with me and talk. Thank you guys so much. I hope that when you get home, finally, you'll go, that was pretty cool. I liked it. I liked it. So I said we're going to do some rapid fire fact or fiction in this last little segment here. So I'm going to just ask you these fact or fiction questions. I'm not necessarily going to point to one of you, so whoever's first, and then you can add on to the other person. So are you ready?
Let's
All right.
go.
Here we go. The first one, coughing during a heart attack can save your life. Fact or fiction?
Fiction.
Why?
I mean, there's no scientific evidence about that. You know, it's just floating out there.
It's just floating out there. For a minute, I thought I was going to have to answer the question, and I was getting nervous. So don't be afraid. Don't be afraid. Okay, taking an aspirin can help prevent heart attacks. Fact or fiction?
There is scientific data to show that if you have had a heart attack, or if you have coronary disease, heart disease, and you take a baby aspirin, you'll have less likely to have a myocardial infarction, which we call heart attack. But if you have no risk factors and you take a baby aspirin, then you won't benefit from it because an aspirin can cause bleeding.
Okay.
So in the past, we would give aspirin, to a population that hasn't had a heart attack. Let's say you have high blood pressure and you're diabetic. We doctors felt that if we give a baby aspirin, then they would be less likely to have a heart attack. But the subsequent studies of the last 10 years, larger studies, show that although there may be in some patients a little bit of in some populations some benefit, the admissions due to serious bleeding complications and complications due to aspirin outweigh the benefits. So the recommendations nowadays is for the general population who doesn't have heart disease and may have some risk factors not to take a baby aspirin to prevent a heart attack, but those who've had heart attacks and have blocked arteries of the heart, they should continue to benefit from baby aspirin.
Okay.
And just to add to that fact, if you're above 75, that's what the study had shown, that your increased risk of bleeding. Okay. So as with several other things in medicine, your care plan should be individualized, based on your risk factors, based on how you feel about it, and the discussion you have with your doctor.
So individualizing is really important. And we've gotten so bad as a society just to attach ourselves to the latest fad, anything that comes along, and we just do it without really taking that into consideration. So you guys check with your primary care physicians, check with your cardiologist before you run down the road of some of these things that are out there. So Dr. Ribeiro, I had a stent placed. Did you know that I have a stent? Did you know I have a stent? So your colleague, Dr. Andy Henry, put my stent in me in 2009, and I have not been taking an aspirin, so I guess I need to get on that, don't I?
I think you would fall into the group of patients who benefit from aspirin. Of course, there is a risk when you take aspirin, like with any medication, of side effects, and one of them, of course, is bleeding from the stomach or from the GI tract. But the statistics show that population like yours who have heart disease, despite you had fantastic job that Dr. Henry did and fixed the blockage, you have by definition coronary artery disease.
Correct.
Because you have some other places where you would have some plaque, and therefore from the point of view of the scientific studies and randomized trials, you would benefit from having a baby aspirin.
Okay, I will get back on it. I snuck off. I should not have snuck off, huh?
We caught you.
You did caught me. Red-handed, red-handed. All right, here we go. Swelling ankles is a sign of heart disease.
It's a fact, but it depends on what sign of heart disease we are talking about.
Okay.
I mean, I know we've been mostly focusing on cardiovascular disease like coronary artery disease, but there's another spectrum, congestive heart failure.
Okay.
It can indicate, it can give a subtle hint that, hey, that you might have a weak heart, low pumping function, go see your cardiologist, get the workup. You know, also swelling of your legs can originate from something called varicose veins,
Okay.
which we see mostly commonly in Arkansas population, and also, you know, we have treatments for them in Arkansas Heart Hospital. So it's not necessarily always a sign of, you know, cardiovascular disease. It can be else, but 80% of the time it can indicate that you are having some kind of congestive heart failure.
Okay. So go ahead.
Yeah, I'd like to add a very good point, Dr. Bavineni aboard. But from the point of view of the general population, the great majority of ankle swelling is because of the consumption of too much salt, sodium, and this fast food type of diets that cause this ankle swelling.
Good point. So you mentioned congestive heart failure. And real quickly, this is not a fact or fiction, but just because you mentioned it, many people in the public, when you say the term congestive heart failure, they believe that the heart has failed. And that's not necessarily the case. Tell us what congestive heart failure is.
Definitely, Vicky. You know, that's a great question. As with everything in medicine, we have evolved in good olden days, you know, always congestive heart failure was associated with your heart pump is failing. But lately, as more research, more data, more evidence has come out, even though your pump function of your heart is normal, you can still accumulate fluid in your lungs and in your body, and that's another kind of heart failure. Just to throw out some medical terms out there, it's called heart failure with preserved ejection fraction. And there's also another entity called heart failure with mildly reduced ejection fraction. So it doesn't necessarily always secondary to pump failure, because what happens, your heart squeezes and relaxes. Even though it's not relaxing well, you can have heart failure from that.
That's good. Thank you. Thank you. I'd always learned about the ejection fraction. You know, I'm not clinical. I've been here for 26 years, but I'm not clinical. But the nurses and the physicians here have been so amazing to teach me, because my job is to go out in the community and then teach. So I've learned so much from our practitioners here. And so I'd always teach that in congestive heart failure, because the heart doesn't squeeze as hard as it used to. So we don't get enough blood back out to perfuse the body like it needs to be with its nutrients and things. So we have a couple of different kinds of heart failure that we need to be looking at. But most of the time we are dealing with ejection fraction and the inability of that heart to squeeze the way it needs to squeeze in order so we've got maximum benefit.
And relax too, Vicky.
And relax, yes, yes. Okay, here's another fact or fiction. I am not having any symptoms So I don't have heart disease.
Well, you can have no symptoms and drop dead at any time due to heart disease. As a matter of fact, 1 in 4 heart attacks, the patient doesn't know they're having a heart attack, and we pick it up later on in many cases. So it's called a silent killer. And you may have a very severe blockage in the main artery of your heart. You could have a 90% blockage and be able to play tennis. And so that's why it's such a dangerous disease, because you may have no symptoms, as Dr. Bavineni said. Some women have no chest pain, and they sometimes experience shortness of breath and fatigue, and others have no chest pain, no shortness of breath, and no fatigue, and there's a time bomb. They could drop dead any time.
Vicky, to add that, I love the fact that Dr. Ribeiro used the word silent attack. It's, in our clinical practice, we see it every day, like how, a John Doe had a ECG done at his screening, and then the ECG showed that he had a heart attack. And he ends up in our clinic to see if he either had a heart attack or not. So that's where screening comes and plays a very, very important role in this.
I've heard it sometimes. People say, yeah, I went to the doctor and the doctor's looking at my EKG and they go, it looks like you've probably had a small heart attack at some point in time and you didn't know and your body's still functioning, but it's just a matter of time before the big one hits that really causes the damage or even takes your life. So, all right, once you've had a heart attack, you should avoid exercise. Fact or fiction?
I would say fiction. As a matter of fact,
I agree.
The evidence is that we should exercise and we should eat healthy. So in the old days, many years ago, when myocardial infarction, heart attack was found to be due to a clot in the heart, patients would stay 1 month in bed, and then they would die of a clot in the leg that would go to the lungs. Those days are over, and the evidence is that exercise is very important. It's very important to resume the sex life soon, and to eat healthy, because the main cause of a heart attack is to eat unhealthy and puff those cigarettes. So that's what the patient needs to do, is to stop smoking, start eating healthy, and exercise, because our heart needs, the arteries need to be worked up. They need to stretch like we do humans. So if you exercise, those arteries will start stretching, and then those hormones, the nitrous oxide starts to be released in the arteries, those hormones that prevent heart attacks. So it's very important to exercise soon after a heart attack.
And we have a great program here, the Intensive Cardiac Rehab Program, our Strong Hearts program, that is very beneficial, because those heart patients are sometimes a little timid about getting back out because they're afraid, I don't want to trigger anything going on. I just had bypass surgery, or I just had a stent put in. What do I need to do? And so the cardiac rehab program becomes very important in getting our people active and in shape, and they deal with nutrition, they deal with activity. Is this something you guys routinely like for your patients that have had a heart attack or surgery to get involved in?
All of them, Vicky, everybody. It doesn't matter if it's a minor heart attack, major heart attack, who had a stent or a bypass surgery, or even if a patient is having worsening angina. As Dr. Ribeiro pointed the fact that you got to stretch those blood vessels. Only that's when you reduce the free radical injury, which happens internally. So your body will get to learn the new blood flow.
That's good. That's good. So there you have it, folks. We've busted just a couple of little myths tonight and hopefully given you some great information. So warning signs and risk factors. When I educate in the community, I like people to, what I ask them to do is I want you to build your cardiac risk profile. So what I want them to do is look at the risk factors. So if I have a family history, that's my first. and I'm hypertensive, I have another one. And then I'm diabetic, I'm now at 3 risk factors. So for me to know how many of these risk factors I have is going to help me know what I need to do the first time I have some chest pain or numbness in the arm. Hopefully, if we're very smart people, we will go, aha, I have 3 risk factors and I'm now having something going on in my body. I need to get some help. So I'm hoping that tonight, some of the people that have listened tonight, hope you guys have heard what our physicians have said. You got to know your risk factors, you got to know the warning signs in order to be able to take care of yourself. So real quickly, tell me what's one thing that you want someone to take away from tonight's talk?
As we've been talking about nutrition.
You?
Yes, I think it's very important that the population has a diet based on plants and fruits rather than fast food chains and sodas.
Just tell us how you really feel, Dr. Ribeiro. He has been a strong proponent, as long as I've known Dr. Ribeiro, on it, that our health and how important nutrition is. We have a couple of educational pieces that we're happy to share with you, your audience, tonight. We have a piece called Warning Signs and Risk Factors of Heart Disease. If that's something you would like, put it in the chat. We'll be happy to email that to you. We can get you information about our Keep the Beat program if you're interested in screening. We talked how important prevention is, and screening is so important. So if I know what I'm looking for, or I may know I don't know I have something going on and I get screened and we identify it, then we can help with that. We've got intensive cardiac rehab that's available. Check out our website, arheart.com. There's plenty of information. You can find out who our providers are. You can find out what cities. Dr. Bavineni, tell me where. I've said his name 6 different ways tonight, and it's Bavineni.
You got it right.
I got it right. Where do you go? I know you have a clinic here in Little Rock, but you also travel a bit. Where else do you go?
Oh, yeah. So I'm available for our patients in Conway, Hot Springs, Camden, Pine Bluff, and Searcy.
Good. You travel a bit. Are you traveling these days, sir?
Yes, I go once a week to Texarkana.
Texarkana, that's our newest offering that we have. So all of our friends down there close to the border, come out and meet Dr. Ribeiro there, of course, in our clinic here. It's a pleasure to get to spend a little time with you tonight. We thank you for your time. I thank you for your time. It's so incredibly precious, and I'm so grateful for that. For you, our listening Facebook friends, thanks for spending a little time with us tonight. We hope you'll watch for us to come back. We hope to bring more of these Facebook Live panels to you because we feel that education and communication about heart disease is so incredibly important. So with that, I would say thanks for being here tonight. Thank you to fine physicians. And with that, I'd say good night and come back and see us again next time.